Great. So good afternoon, everybody. Thank you very much for coming to our webinar today on addressing health literacy needs. My name is Helen Ryan. I work with the National Adult Literacy Agency, NALA, and we're delighted to have three very esteemed guests today to give some inputs on the whole area of health literacy. We're going to open up with Deirdre Coy, who works in the Department of Health. Deirdre's going to chat to us a little bit and share some findings from the pending publication of the health literacy survey. So we're really delighted to have this statistical report on its way. So it is pending, it's written, and it's within the department. So can't wait to hear from Deirdre around that. After Deirdre, then we're going to move to Sarah Lane, and Sarah works with the Irish Cancer Society. She's the Cancer Information Editorial Lead, and Sarah and ourselves in NALA have been working on Cancer Health Literacy Project, but she's going to talk to us a little bit about cancer health literacy and some of the work and the importance of that. So again, looking forward to hearing from Sarah. And then finally, we're going to move to talk and hear from Mary O'Hora, who's the Information Centre Manager in St. Patrick's Mental Health Services. So we acronym that out, but it's a great hospital that we've worked very closely with, and we've done lots of literacy friendly work. And Mary's going to share her experience and what the hospital is doing and the services are doing there. So again, I think really interesting input to come. So without further ado, I've mentioned we're recording this for colleagues who can't make it, and please put questions into the chat and we'll go through them as we go through. And so with that, let's hope the technology works. And Deirdre, we will hand over to you from the Department of Health, who's going to chat to us a little bit about the survey. So that will be great. And Tifa, thank you. You just put that bit in there about sharing with everyone about their cameras. Great, Deirdre, so over to you.
Hi, everybody. I'm going to attempt to share this and see. Oh. Mic start slideshow.
I know the joys we're just saying, getting back into technology.
Yeah,
there you go.
Every time.
Yeah.
There we go. So now you're just looking straight at the slides. Yeah, perfect. Yeah. So I'm Deirdre Coy. I'm an economist in the Department of Health. I'm the new principal investigator on the Health Literacy Survey of Ireland. And yeah, as Helen said, we have a forthcoming publication that's been kind of ready to go for a while, and we're hoping to publish it pretty soon. Again, I'm fairly new onto this project. My colleague Lucy Bruton is the person who did most of the work on this project, and she's lucky enough to be off on career break at the moment. So I'm kind of largely communicating the work that she did. So I'm just going to bring you through some of the main findings today and kind of relate them into the kind of the webinar's theme of addressing health literacy needs. Oh, can we? There we go. So the survey itself is about personal health literacy. So this is the kind of reading, listening, reasoning, and problem-solving skills that we need to make informed choices about our healthcare and health. So in the survey, there's kind of 4 ways that we talk about how we use health information. So this is finding, understanding, evaluating, and applying health information. So as kind of just some examples, if you might be looking at how to find out where to get professional help when you're ill. You could be trying to understand information on food packaging. You could be judging if the information on health risks in the mass media is reliable, and you could be acting on advice from your doctor or pharmacist. So you can kind of see from those examples that we're kind of talking about kind of 3 areas in which people are sort of applying their health literacy that the survey looked at. So one is kind of healthcare. So that's, everything from kind of working on what treatment options you should have through to communicating with healthcare professionals. There's disease prevention, and there's health promotion. And there's a good bit of sort of interaction between disease prevention and health promotion, but it covers everything from kind of healthy behaviors to vaccines and things like that. So the survey operated across 17 countries. The international report is out, and you can read that. It's up on the MPOL website. So MPOL are sort of a group within the WHO Europe who are sort of spearheading the health literacy surveys. In general, in Ireland, when we kind of compare ourselves to other countries across Europe, we generally see that we have quite high levels of health literacy in Ireland. So a little bit quickly about the survey respondents, just to kind of show that we have a real variety of people responding. So it was a nationally representative survey. So this means that, you know, we kind of did all the sort of statistical sampling to try to make sure that we're kind of getting a snapshot of Ireland as a whole. So there are almost 4,500 participants in the survey, and the respondents were kind of very diverse. There were many who were well educated. Around 3 in 10 people had third level degrees, but this is kind of in line with what we know about the population as a whole. We asked respondents lots of questions about their health service use, and their socio-economic characteristics, because when we're trying to work out health literacy levels, in particular, if we're trying to kind of address particular health literacy needs, we wanted information about kind of vulnerable groups or groups where we may need kind of particular interventions. So in terms of health, many people in Ireland, as you probably know, report that they have kind of chronic diseases and long-term diseases that affect their daily lives, almost 4 in 10 people. But at the same time, lots of people report kind of generally quite good health behaviours. In particular, almost everybody who responded to the survey said they eat fruit and veg at least once a week, which is heartening. We then looked at some of the kind of socio-demographic characteristics in the of the respondents. And again, you see sort of lots of sort of interactions between people's characteristics, and this is a sort of a major theme that comes out in the paper. So while there are lots of people in Ireland who are, you know, have good health and they feel kind of secure and happy in their day-to-day lives, there are lots of people who are at risk of what we call social exclusion. And this can mean things like having severe financial difficulties, feeling socially isolated. And we see that kind of intersecting then with their health and their healthcare use. So for example, around 3 in 10 people report that they have difficulty in paying for medical treatment. So then the results in terms of health literacy overall, as we kind of saw in the kind of comparison with our sort of European neighbours, lots of people in Ireland do have good health literacy. In particular, almost 4 in 10 people have what we call excellent health literacy. But I suppose for our purposes, we're more interested to some degree in identifying people who maybe have problems with their health literacy. And this is what we refer to as limited health literacy. So around 3 in 10 people are kind of identified as having limited health literacy. This is really just based on going through the sort of all of the questions that they're asked about their health literacy. And then there's a sort of an international benchmark that's set for kind of how to indicate whether or not somebody has limited health literacy. And typically it's that they're sort of expressing across all the domains, they're sort of finding it difficult to understand, to find, understand, apply, and evaluate health information. So we also look at a lot of kind of statistical models, because we're interested in seeing, in Ireland, does health literacy predict your health status and vice versa? So we kind of control for lots of socioeconomic characteristics that would often be associated with your literacy, with your health literacy or your health, such as your education level. But even when we control for those factors, we see that typically if you have very good health literacy, you're also more likely to have good health, and that you're more likely to kind of report that you have kind of good levels of health behaviors. And then on the other side of it, if you have quite limited health literacy, you're also more likely to report that you have poor health. You're also more likely to report that you have very high health service use. In Ireland in general, when we're talking about the sort of 4 areas of health literacy, people in Ireland are quite good at understanding and applying health information. So an example of this is that 94% of people say that they understand how to act on advice from their doctor or pharmacist. Throughout the report, the questions about kind of interactions with healthcare professionals, a lot of people in Ireland respond with kind of a lot of confidence in their ability to kind of, again, sort of all 4 stages of health literacy. They feel a lot of confidence in their ability to kind of understand or apply or evaluate information that they receive from their relationships with healthcare practitioners. The big area where we're seeing sort of kind of consistent struggles across a lot of the population is in evaluating health information. So in particular, we see this in relation to kind of media, social media, and kind of online information, and what we kind of sometimes refer to as sort of informal use of health information. So here we see that kind of over half of people in Ireland say that they find it difficult to judge if the information about illness in the mass media is reliable. And they also find it difficult to judge whether online information is reliable or offered with commercial interests. So sort of regardless of kind of like age or education level, we kind of see that there's a fairly high level of people reporting difficulties with evaluating health information. So in the report, we kind of particularly decided to look at kind of particular groups that the literature said there may be sort of issues with health literacy. One of the main groups we looked at are those that we're kind of deeming as being at risk of social exclusion. So again, as we said in the sample, there's a kind of a big variance in the people who responded to the survey, but about 1 in 10 people say that they have really severe financial difficulties. And we find that when people have really severe financial difficulties, these challenges are often coupled with other challenges. So people who have really severe financial difficulties are also more likely to have very low social support, low levels of education. And then in turn, they also have worse health outcomes, generally poorer health behaviors, and very high levels of health service use. So people with kind of severe financial difficulties are 3 times more likely to report that they were an inpatient in a hospital in the previous year compared to the general population. And then I guess kind of unsurprisingly, we then see that that is then related to your health literacy again, that there's a correlation there. So while around 30% of people in Ireland have limited health literacy, that increases to almost 50% in people who are at risk of social exclusion. And this is the case kind of across all of the different areas that we think about in terms of health literacy. So we also asked kind of questions about vaccine health literacy, digital health literacy, and COVID-19, so your ability to kind of use information related to COVID-19. Across Ireland in general, there's very high levels of health literacy in relation to vaccines, but again, in sort of groups that are sort of at risk of social exclusion, they're much less likely to score well on vaccine health literacy. So while in the general population, people on average score around 80 out of 100, in groups that are at risk of social exclusion, that falls to 60. So from this, we're sort of identifying that there are definite, while health literacy may be good in the country overall, there are definitely population groups that we need to be thinking about targeting in terms of addressing health literacy inequalities. Another kind of theme that came up throughout the paper was that of kind of communication and engagement. So people at risk of social exclusion were one group that we isolated to kind of examine in particular. We also looked at older people, we looked at people with cardiovascular conditions, and we looked at healthcare professionals. So for older people in Ireland, as you get older, your health literacy typically improves. This is unusual. Like in many European countries, health literacy declines with age. We theorize that this might be in part driven by the fact that we have slightly higher literacy levels overall, but we're kind of generally unclear on it. However, this isn't the case when we look at digital health literacy. So while older people in general have very good levels of health literacy, when you ask them about digital health literacy, their scores are much lower than the kind of the national average. This is particularly a concern when we're talking about that kind of digital transformation of health. The survey took place kind of during the COVID-19 pandemic, when a lot of health services and a lot of information about COVID-19 would have moved online. So it's concerning that a group that has typically had very high levels of health literacy might be sort of at risk of being marginalized by the kind of transformation of how we're conveying health information. Then we also looked at people who have cardiovascular conditions. This is that we're sort of in particular interested in looking at groups who would probably have sort of consistent engagement with healthcare providers. People with cardiovascular conditions do report sort of consistently relatively high healthcare use across kind of GPs and hospital visits, but they don't have unusually high levels of kind of GP use. So in this group, they generally have kind of health literacy that aligns with the population overall. But interestingly, it doesn't translate into health behaviors, whereas for the population as a whole, we generally see that if you've got higher health literacy, you've higher health behaviors. In people who report cardiovascular conditions, we don't see that correlation. There's also kind of differences again within the types of health literacy that they feel confident in. So in this group, there's very, very high levels of vaccine health literacy and relatively low levels of digital health literacy. Again, part of this is probably driven by the age profile of people who report having cardiovascular conditions, but it shows sort of the intricacies involved in trying to kind of target health literacy interventions towards particular groups, because general trends aren't going to kind of hold in subgroups. And then finally, we looked at healthcare professionals. Unsurprisingly, they generally have quite good health literacy. It's about kind of on average with the rest of the country. But unlike the general population, people who have healthcare training feel very confident in their ability to evaluate healthcare information. In terms of what kind of brings them back down towards the average, they're typically less strong in terms of their confidence around health promotion. And they have a very high use and very high literacy level in digital health information. So this is interesting for us in terms of when we're looking at kind of vulnerable groups, and we're seeing that digital health information is particularly where struggles are evident. On the other side of it, often the people who may be trying to communicate that information are the people who are often quite proficient and quite confident in that kind of medium of health information dissemination. And then finally, the pandemic has kind of given us a lot of insights on how we should act. So we were kind of looking at all these sort of different levels of health literacy, and many of the sort of key messages around health prevention and healthcare during COVID-19 were effectively communicated regardless of health literacy levels. So we see that things like hand washing, covering coughs and sneezes, these sort of health behaviors that were heavily promoted during the pandemic were high regardless of literacy level. And this to some extent, I think, tells us that sort of really good communication and really good dissemination of reliable, consistent health information is effective regardless of somebody's health literacy levels. So then finally, just in terms of the kind of theme of the webinar and talking about addressing health literacy needs, I think the sort of three big issues and three big areas that kind of came to the fore in the report. One is on the use of informal health information. So that idea of kind of using Dr. Google, or, you know, just even trying to use kind of online sources and media sources to kind of judge your own health. There are some sources out there, such as ihealthfacts.ie, which are used to try to kind of support the evaluation of online sources. But we'd hope that there'd be kind of further awareness and dissemination of kind of interventions such as these. The digital transformation of health has been a kind of a theme that I've come back to again and again, and there is a real risk of there being a disparity in digital health literacy between healthcare providers and the broader population, and between kind of more vulnerable groups such as older people and people at risk of social exclusion and people with long-term health conditions. So this is where we come to sort of the role of service providers. Healthcare workers are very good in areas where, as a population, we're a little bit more lacking in terms of health literacy. That's in particular in the evaluation of health information and in digital health literacy. Importantly, the population is also very confident in their ability to use information that they glean from their relationships with healthcare providers. So it seems that there's an important role, especially for frontline providers and in the kind of the integration of care when we're talking about very vulnerable groups. And it's clear that kind of good quality health information is effective regardless of health literacy level. So it seems like there's a real opportunity in terms of addressing health literacy needs to think about it from an organizational perspective. And that's actually what the next survey in the kind of health, so we're just finished Health Literacy 2020, I suppose, and we're about to start kind of rolling out the next round of the survey, and that will, well, we're not about to start rolling out, we're currently in planning, but sort of next year, the end of next year, we hope to plan to roll out the next version of the survey, which will switch from considering personal health literacy to thinking about organizational health literacy, and with that thinking about how we can better deliver and communicate health information that will be effective for people regardless of their health literacy levels. Okay, thanks very much, and I think I'll try to stop sharing.
Thank you, Deirdre. That was really interesting. And I suppose our work on health literacy, Nala's been working on this for over 20 years now, and we're delighted to see a new statistic. So I know the last one was 40%, and now it's down to 28% of people with limited and low health literacy. So I think there's a lot of work for us all to be conscious of so for providers dealing with people every day. I always say to people that means 3 out of 10 of the people who will come into your service may struggle with the information that you hand them, or if it's a medication label, trying to work that out, for example, or indeed the digital health literacy, which you mentioned, which is another whole element, I think, that came to the fore with COVID and is continuing on. So if anyone wants to have a look at some of the results, because the international report, I've just put the link up there to the MPOL website that you mentioned, Deirdre, and we can't wait to have the Irish report out and deep dive a little bit more into the results, because I know the role of the Department of Health was to produce the report, and you funded that, and through Sláinte Care we're delighted that we'll have that big mammoth of any academic that likes reading stuff like this. There's a lot in it. I mean, I've seen it, but it's good reading. And Nala will work maybe with taking strands out of that. But also, I suppose we'll be using the results to then talk to the Department of Health, to our own Department of Further Higher Education as well, and other departments around how can we address health literacy needs of the population. And so delighted to see at your last slide there that the new survey is looking at the organisational health literacy, which is very appropriate, because as we move into hearing from Sarah now, we'll talk about the cancer health literacy area. And when Mary talks about an actual practical site, that's where the organisational health literacy piece, I think, really does come to the fore. So thank you. So someone has a question, 2 questions in. So I'll deal with Mel's question first, which is, do we have a date yet? I know it's your dreaded question as to when the Irish survey will be published.
I think generally the answer is probably fairly soon after the budget, depending on how that goes.
Okay, great. So Mel, hopefully that'll be out then, and we'll look out for it. I mean, the department will probably do how you launch things, possibly a soft or launch. Nala will be all over it and trying to put it out on our e-zines and social media and so on, to try and get as many people to sort of be aware and read it and look at it. And then Elaine has a question here. So Elaine said, have you any advice on how to address health literacy with patients? Could be difficult to broach if you're highlighting a deficit, or if they felt not intelligent, for example. So Elaine, very good question. Really interesting what we're moving into now. And we move in, we actually worked with the Irish Cancer Society with a lovely course, which again, we'll put a link up, that actually looks at advice around how to deal with cancer patients within our thing we worked on, but it is absolutely applicable to all patients when you watch it. The main advice really in general, as I worked in this space in a good number of years, really is that you treat people, first of all, as you would with, absolute dignity, respect. You chat to them. You use what we all have, which is the tongue, the gift of the gab. We chat to someone. Where if somebody cannot read a leaflet that you're giving them, or fill in a form immediately that you need filled now because I have an operation at 4 o'clock, by chatting to somebody around that, so if it was, I need you, Deirdre, now we're going to have this operation now at 4 o'clock. I need you to sign this form. Are you all right with having a look at that form yourself, or would you like me to go through it with you? So if you think about that, I didn't say, I don't think you can go through it. I didn't say, I think you might struggle with that. So you ask people very nice and comfortably, normalizing the situation. Is that okay for you to go through that yourself? If the person needs a hand because they are going to have to read it and sign it today because I'm going in for some procedure, then, your tone and the way you approach it, I think they would do that. So that's just one example. And absolutely interesting you raised the issue there, which is really important. The gap really that health practitioners are looking for, to me, is that the literacy and numeracy gap immediate in front of you to do with the health condition. So don't worry whether they can read a magazine or whether they, will struggle with writing a journal or whatever it is. It's just about getting them through the immediate health appointment that you're working with. So I think you're going to get a little bit more when we move on. Sarah and Mary will be touching on a lot of that practical stuff as well. And Caroline has another suggestion or another question there. Is there more ease of access for videos rather than written information for people with health literacy difficulties? So actually, I'm going to leave that one because Mary has a great story when we come to Mary about how she uses videos in her work. And then Caroline will come back if you want to have a chat about that again. Okay, so thank you so much for the questions. People, it's really good to get some interaction on that. And without further ado, Sarah, I'm going to hand over to a colleague worked very closely with on a number of projects from the Irish Cancer Society. And we look forward to hearing from you now, Sarah.
Right, I'm trying to share my screen now. Is that working? No?
No, not yet, but I'm sure.
Right. Should be right.
Joys of technology now. Yeah.
Right now, yeah.
Yep, that's it. Great.
Okay. Yeah. So that's interesting to hear the Irish survey. and the kind of more macro perspective, and we're a little bit more micro now, just focusing a little bit on cancer patients, what we know about their health literacy needs. Although I would say, as Helen was saying about our healthcare professional video, that even a lot of the stats in general around health literacy that have developed over the years, from sort of global research, are applicable to lots of different people. It's not just cancer patients. So I'll just give you a little background on us and our information, just to kind of contextualize the work that we do, because health information is a really important thing for us, and obviously health literacy is about people's ability to get, understand and use health information. So in the context of patients particularly, we're a major provider of medical and supportive information for people with a cancer diagnosis. The booklets that you can see there on screen are used in many hospitals, and they are really kind of a health literacy tool because they supplement the information that patients get in hospital. And we know that people with lower health literacy may not understand or remember the information that they get in the consultation. So it's supportive for them to have an additional source of information that they can use when they have time and when they're in the right frame of mind to take in that information. And also, although, and I will discuss it a little bit later on about written information, the booklets are very good because not only do the patients use them, but they can hand them off to a friend or family member. And that's actually really important for people with low health literacy, because they do tend to rely on other people to help them sort of navigate health information. So obviously, because we provide health information, and particularly in the field of cancer, where health literacy challenges definitely exist, we're obviously interested in both literacy and health literacy, and we've been working with NALA over the years on various projects to try and improve things. So basically today I'm just going to try and give a little bit of insight on what we've learned about, well, I can call it cancer literacy, but as I said, it's kind of fairly broad, so it could really be applied to health literacy in general, how health literacy needs impact on people, and how we're trying to improve things. So just talking about the impact of health literacy needs, this is, knowing some of this stuff is why this is so important to us, because we can see the impact that health literacy needs have on patients. So these are just some of the key areas. So this is from research, mainly in the field of cancer. But as I say, a lot of it can be applicable to other diseases or other groups. Understanding treatment. So people with health literacy needs are more likely to find it difficult to understand their treatment. So things, even just understanding the difference between curative treatment and palliative treatment. And understanding treatment also has an impact on informed consent, which nurses have raised with us, that if people don't understand their treatment and the implications it might have for them, it's difficult to say that they're really giving informed consent. And, again, particularly with cancer, there's some complex treatments out there. And in some cancers, patients are asked to make a decision between different treatments. So, in that sort of context, it's really, really important that people understand and that healthcare professionals communicate well. So adhering to treatment, so people with a lower health literacy are less likely to be able to follow treatment plans correctly. They're less likely to take medication correctly. And obviously, things like chemotherapy can be given as tablets to be taken at home. And underdosing can mean that their treatment won't work as well. And overdosing or not understanding contraindications can mean that they become unwell. Distress is a big issue with cancer. Obviously, it's a very distressing diagnosis, and the treatment can be very distressing. 4 out of 10 people with cancer experience severe distress, But people with low health literacy are more likely to suffer distress, and that may be because of, you know, they don't understand and they have unmet information needs. And then on service use, people with lower health literacy visit emergency departments more and tend to have longer stays in hospital. And that may be linked to some of the things we've already talked about, such as, you know, maybe not taking their medication correctly, not understanding when to contact the hospital if they have a problem, or not understanding their treatment very well. So that's kind of the research aside, just a brief summary of some of the impacts that health literacy needs can have. And these are some quotes from recording of the type of inquiries that our cancer nurses got during COVID, because that's when we recorded the types of calls in detail. So yeah, so it kind of just gives I suppose, even more kind of micro understanding of the kind of impact that health literacy needs can have on people. And I think it's, you know, interesting to know that, like last year, our nurses had almost 7,500 queries on cancer treatments and side effects, over 4,000 on managing symptoms, and 1,600 roughly on prognosis. So you can see that there is definitely a high number of people with cancer who have health literacy needs, who have you know, unanswered questions or confusion around their treatment and their care. And I think, you know, those quotes as well, you know, they definitely highlight, you know, potential health problems, and you can really feel the anxiety and distress that can come from having health literacy needs. But they also kind of give a clue, I think, and contribute to difficulties finding, understanding, or using health information. So if you look at the quotes there, you know, there's some that just doesn't understand, some that are underconfident in engaging with healthcare systems, you know, ringing the doctor. Some are unwilling to ask for clarification. And then there's one there where she just was off guard in her consultation. So she just wasn't in the right frame of mind to take in the information. So those are just some of the factors. There are lots, too many to discuss here. But I think for some insight, you know, especially if you're sort of trying to address health literacy needs, there's just some of the main ones here. You know, these are certainly ones that we really think about when we're trying to make our information more health literacy friendly. So literacy is allied to health literacy. In general, people with lower health literacy have more health literacy needs. And really, you know, you can understand that because a lot of healthcare does depend on someone's ability to read, write and understand written text and numbers. If you think about, you know, just going into the hospital and being able to read and make sense of the signs, being able to read and understand a medication label, being able to get information from posters, leaflets and booklets, and filling in forms and things like that. So is a really big one. As we saw with the calls, confidence, you know, can really knock people's ability when it comes to health information and getting what they need. You know, if they're worried about bothering a busy healthcare professional, or they feel embarrassed to ask a question, you know, they could be left with, you know, an unanswered question that can make them anxious or can make them ill, and they may not report side effects or other difficulties between appointments if they feel scared to ring the hospital and trouble people. Emotions are really big, and as I said, particularly with cancer. So if you're, I mean, it's been proven more than once that if you're upset, anxious or frustrated, it can really affect your ability to process, remember and use health information. And it's important to note as well that somebody that could have very high literacy and health literacy could have really poor health literacy if they're experiencing difficult emotions. And one of the nurses that collaborated with us on our project for healthcare professionals was saying, you know, they often have a big consultation at the time of diagnosis, and they just walk out and haven't taken anything in because they're trying to process their diagnosis and the news that they've had in the early days of their diagnosis. So that's just one example of that. And then, context and format is really just how the information is communicated, whether the format suits a person's need, how much information is given at a particular point in time, and how complex it is. So obviously, you can imagine that some people, if the format isn't right for them, if it's too complicated for them, if there's too much information for them, they're not going to take in very much. So moving on to meeting needs. I've kind of broken it down into 3 areas that we work on in the society. Now, the first one is a very long-standing endeavour with us, really just, particularly our booklets, but also our website, and, having other channels available like the support line, nurses and the daffodil centres, which importantly offer an alternative to written information, and kind of follow up as well. If people still have questions after looking at the other information channels. But I'm not going to talk too much about that, just to say that over the years, we've really we've worked with NALA, so we really try and focus on plain language and clear design and making our information as user-friendly and accessible to lots of people as possible. But I'm just going to talk today, because time is limited, about 2 more recent projects, and also because they're 2 kind of different dimensions of health literacy, empowering patients and supporting healthcare professionals. So empowering patients, yeah, I suppose, like, when you're engaging with health systems and you're not used to it, it's really like being in a foreign country. And people can feel very lost, or they can feel embarrassed or overwhelmed, especially with a difficult diagnosis like cancer. And as we've already seen earlier on, when people don't have enough information about their health or where to get support, they can feel very lost, and it can have a really bad impact on them. But at the same time, services are very busy, and service providers may not be aware that a person hasn't understood or hasn't got the information they want unless the person says this. So an element of good health literacy practice is to try to empower patients to take a more active role in getting, understanding and using health information. And some of that can be done, on their own, but some of it also relies on service providers, just to do simple things to make people feel more comfortable, even just having a welcoming attitude so they can feel more at ease and confident, or encouraging them to ask questions, or to bring a support person with them to appointments. And on the screen, the middle picture is something that we're including in all our cancer booklets now, where we're trying to prepare people for what to expect at hospital, to make sure that they bring everything they might need, so they don't get worried about not having what they need. And also further on in that little section, there's also about asking questions and making sure that all your questions are answered. And then on the right, again, it's just trying to sort of demystify, the cancer journey, I suppose, and what to expect, and standing up for yourself for things like maybe getting a second opinion that people might be feel a bit nervous about, and giving follow-up information more possibly than they might get at the hospital about things like side effects, so that they can manage at home themselves, so they know what to do and when to call the hospital. Yeah, and then the thing on the left is the project that we did with NALA, which, as well as helping with our health literacy goals, as somebody said, is also a video resource, and we're keen to provide more video resources. And we did actually, at the start of this project on health literacy, we surveyed some cancer patients and cancer nurses, and the cancer patients did say that they wanted more audio visual resources and information. So yeah, so this is just some of the screenshots, including the lovely doggy. So this project, trying to focus on empowering patients to manage their own care more. We did with NALA, and it was also supported by MSD Ireland. So, I mean, there's lots of key areas in health literacy, but we picked 3 sort of based on the research and on our the things that people were calling our support line about. So they're just little short 2-minute videos with people sharing their experiences, and then some tips to help people who may be struggling in those areas. And they're on our website and NALA's website if you want to look at them. And then the third area is supporting healthcare professionals. And you know, in a way, I feel this is a slightly new area in health literacy, and in a way to meet health literacy needs. Because, you know, I mean, I think even the fact it's called literacy, it kind of suggests it's a skill that the patient has or doesn't have. And so that the burden to improve things lies with the patients. And that's valid to a certain extent. But I think now there's a greater realization that to make services efficient and offer people the best outcomes, there is a role for healthcare professionals and health systems in supporting health literacy needs. The element of health literacy that we saw earlier about how the information is presented and how complex it is something that lies in the hands of healthcare professionals and information providers. And that's not to say that healthcare professionals don't care about health literacy and they don't care about their patients and that they do a bad job. But the reality is that we know that there can be a mismatch between a clinician's level of communication and what the patient takes from their level of comprehension. And, you know, I think the nurses recognise that to a certain extent, and really, you know, as you'll see from that slide, you know, they would like more time with patients, and if they had infinite time, you know, I'm sure it would be much easier for them. And we can't give them more time, unfortunately, and we know that they have a certain amount of information that they have to give to patients, you know, within the limited context of the appointments. But we did feel that we could help with the first one, which was some health literacy communications training. So we've developed an e-learning module, which aims to raise awareness of health literacy issues and the extent of health literacy issues. And then the second half is tips on how to communicate well and address health literacy challenges. And again, this one was in partnership with NALA and supported by MSD Ireland again. Yeah, so I mean, that's most of it. Just to say that, you know, it's an ongoing process, that things change, needs change, literacy levels change, you know, what patients need and what healthcare providers need change, and technologies change as well. So, you know, we're constantly evaluating what we're doing. So yeah, so that's it really. I hope some of it was of use, and I'm happy to ask any questions. And as Helen said, I mean, that the e-learning there, the communication tips are kind of standard, you know, health literacy best practice. So if you're looking for any guidance, you know, I would definitely recommend that you have a look at it. Okay, thank you.
Thank you, Sarah. That was brilliant. Thank you so much. That was a really interesting sort of round in the whole lot. So just hearing it again was great, actually, you know, because it and I suppose we're delighted to have the relationship we have with the Cancer Society. It's really important. I mean, we've worked together for years on plain English and auditing and these nice projects that we've been doing. And I say nice, meaning that it's really nice to actually engage with another NGO, you know, with your topic being cancer and our topic being health literacy, and come together and develop those great resources that we have. So Aoife put up the link there to the health literacy awareness videos. So they're 3 short snippets. And again, some practitioners, I think, are using them when they're training some of their colleagues in academia, and then they're also forwarding them on to individuals who might have cancer diagnosis and whatever to listen to. So that's the awareness video pieces. And then the course, the sweat and tears, Sarah, that went into the course, that we're delighted we have it down to a 20-minute short course. It's available on both NALA's website and the Cancer Society website. So I have the 2 links there. And again, we welcome any feedback on the small videos and the courses as well, which is great. Okay, there was 1 or 2 questions in there, Sarah, linked in. So there was another question there about any references around the point of not being able to take in information when experiencing strong emotions. There would be that would be a lot on probably under health and psychological care of people. So again, we can find that out and link it in. But Nikki, just to say to you, there is an amazing, so the guru of health literacy in the world is a lady called Helen Osborne, with no U, it's B-O-R-N-E. And that her website there that I've put up, she has huge amount of podcasts and information, and she's written a book. And actually one of her books, she talks about emotion and the fact that the emotion affects your whole ability to take in information, and the link to health literacy. But we can find some more stuff for you, Nikki, after and send that on. And then there was another question Anne had: are there available resources for departments to create video content for the people we serve? So again, Anne, I suppose that would be about going back in, are there resources? That's about whatever setting you're in. So for example, if you're in a hospital setting, and I've worked with Limerick Hospital, Tala, St. Patrick's, lots of places, you will have to just pitch for some funding to do that, and hopefully that is possible. In terms of national accessing funds for innovative work, I suppose the Sláinte Care Innovation Fund that was there, that's potentially, when the next round comes, an opportunity for that, but we can link in with you, Anne, separately to that after that. Okay, so our final input, we're delighted to move now. Thank you, Sarah, and thank you, Deirdre, too. I hope I'd said thank you at the end of yours. The last very practical piece now we can't wait to hear is from Mary, and Mary works in, as I said, as the Centre Information Manager in St. Patrick's Mental Health Services. And Mary, we're really interested to hear what you're going to share with us today.
Okay. So thank you very much, everyone. My name is Mary O'Hora. I'm just going to share my screen. So I suppose what I wanted to share with you today was really our journey at St. Patrick's Mental Health Services to becoming literacy friendly. And I suppose the transformational changes we had to make around health literacy, in particular when COVID came. So hopefully I'll just share my screen now. And okay. That's not sharing just yet. I don't know why. Okay, share screen again. Screen. Here's just,
yeah.
No, I have it. Yeah, I have it. It's fine.
Panic
over. I do this every day, and then suddenly it just doesn't work. Okay. I just want to check that people can see that fully.
That's perfect, Mary.
Yeah, perfect. So what I've said is the journey to becoming a literacy friendly hospital. So a bit about ourselves, really. We're St. Patrick's Mental Health Services. We are independent, and by that we don't receive government funding. We're not-for-profit mental health service provider. And I suppose because we're independent, we can do things slightly differently. We can probably move ahead of most other things because we don't have the same constraints that many other providers would have, particularly being part of a very large organizational structure. But as a service, we have 3 approved centres: St. Patrick's University Hospital here in Dublin 8, St. Patrick's Lucan, and we run an adolescent unit for 12 to 18-year-olds. So we also offer inpatient, day patient, and community support through our network of Dean clinics. I suppose one of the things for us is that we're committed to developing competencies for those choosing to work in mental health, and to working with organisations providing mental health care services, support and advocacy. And we really try and frame things in both human rights and an evidence-based approach. And I suppose we've been working alongside NALA now since probably 2015, 2016. And so we've been on this journey for quite a while. We've had a few bumps and starts on the way, but I think maybe some of what we've learned may be of use to other people on the journey. So I suppose I first became involved with this in 2016, 2017, when I held a dual role here in the hospital around service user engagement, but also as an information centre manager. And I suppose we as a service also had over time been recognising that, you know, we were not meeting the needs of people with both literacy and digital health literacy difficulties. And I suppose as a service, we'd already done some literacy awareness raising with various staff, but there was a real appetite to address these issues for service users, so that they could be better empowered in their recovery. So one of the key tenets, I suppose, on which we base our services, we want to empower the people who use our services. So we want them to take ownership of their recovery, and being literate and having health literacy is a key tenet in that. If people don't understand their illness, and sometimes, you know, they have quite complex needs, they may be taking medication, they may be undertaking various types of therapies, they may have some long-term therapy that they need to undertake. And if they can't really understand that or get to grips with it, how are they going to buy into it? How are they going to take ownership of it? So we were very, very conscious of this, and that there was this unmet need, and there was almost like a kind of a passive approach to, oh, the doctor will tell me what to do and I don't have to do anything. And for us, recovery is about people taking ownership of their difficulties and learning to live with and live well with. So we had to change that around. And I suppose that was one of the key kind of starting points. But also, you know, we did recognize that we as a service, and a lot of health professionals do this, we're all great with the acronyms, you know, so you have DBT for BPD and EUPD, and we have ACT, and we have all of these things. And people would look at us and go, well, what does this mean? So, you know, we're very, very fond of big fancy words, but we never really explained what it was for people. And on top of that, our pharmacy department had already been working on the Crystal Clear Pharmacy Mark, which is again around promoting knowledge and understanding of the medicines that you take. So we as a service agreed with NALA, and we were delighted to partner with them to actually, they had developed an audit set, which was 18 quality standards for a health literacy friendly hospital. So we said, yeah, we'll have a go. And we did. And we were the first people to do this audit. I suppose we had a literacy audit, a big action plan, and a review of standards over an agreed time frame. So what did we really do to really improve digital literacy, to improve health literacy here? I suppose the first thing we did, you know, when people go, oh, committee for a committee, we set up a literacy committee. And my golden rule about having people on committees, they must do something. So we had various staff, I suppose, who were already champions in this area who had a genuine interest. And we ran a number of literacy audit workshops. So what we did, we took a snapshot of our organization and looked at, well, what's working, what's not working. And then we asked all of our departments to submit examples of their work or publications that they had done, to really look at them and go, you know, can people really understand this? Have we written a load of gobbledygook for people that's too far flung? And in fairness, in collaboration with NALA, which was fantastic, we were able to put together an action plan. And I suppose that we as a service are committed to changing our culture of how we communicate and how we consider numeracy, literacy needs in all our documents that we produce for staff, for service users and the public. And by the way, we're still a work in progress, and we do remain committed to, I suppose, maintaining our service as a literacy-friendly hospital. And literacy in terms of health literacy, but more importantly now, as a consequence of COVID and our digital transformation, being digitally literacy friendly as well. It's always been a really interesting thing for us, because we've had lots of challenges along the way. We've had stops and starts, but I suppose we've never stopped going forward. So I suppose we took a bottom-up approach. What we wanted to do was change the organizational culture. And in changing the organizational culture, we were hoping then that would then empower service users more. Now, we took a parallel approach around how we deal with service users and how we communicate with them. But I think our real piece was we really wanted for staff to take ownership of this, for it to become embedded in our culture. So we did things like information briefing sessions, and Helen kindly, she will probably remember it very well. We actually had a debate. We would have a weekly, I suppose what we call academic meeting here. So we had a debate on plain English in where, you know, we knew we would get the intention of a lot of senior members of staff, but also of a lot of our clinicians. And it was really the toing and the froing. And was, you know, it was an interesting way to do it, but it was innovative for us because it really got people thinking. You know, we've done things like all our signage has been reviewed. Our website is very much a work in progress. We changed all our forms and our documents. But also, I suppose, what we ingrained into our staff and we ingrained into people was, you know, not to be afraid to say to someone, does this make sense to you? To ask the question in a very informal way. One of the things, because I run an information center, I get people from all around the hospital. So very often people will come down to me and they'll go, I need to find out about a particular therapy. And they say, and I want to buy this book, and it's probably 600 pages and it's very theoretical. And nearly the first thing I would say to them, they said to me, well, would you recommend that book? And I go, well, you know, it's a really good book. But I'd often say to them, are you much of a reader? You know, would you read normally? And they'd say, no, I haven't read a book for 30 years. I said, would you watch video instead? Oh yeah, that'd be great. That'd be much easier, because they'll see the book and it's overwhelming. And you have to remember the people who engage with mental health services are already overwhelmed. A lot of people experience big emotional distress. They may have very low mood. They may have anxiety. So for them, concentration is out the window. And the thought of sometimes even reading more than a page is actually almost overwhelming. So very often I will gauge where people are at. They'll come down looking for information, and I'd say, you know, well, I give you a small bit to begin with, and then I can get you more detailed stuff afterwards. And you can see the relief coming over them that they don't have to read a whole tranche, but that they can get accessible information that will get them started and give them the basics of the knowledge they need to understand their illness. So for me, that's been a huge piece around, you know, informally asking the question, but in a roundabout way, not highlighting to somebody, well, you don't understand this. You don't need to do that. And it's really, really important in your approach. It needs to be just very gentle, very, very calm, but also gauging, because I know when I look at somebody's face, they're looking at me and you can see the blank and they're going, I don't know what to do with this. So you can very kindly and gently say, do you want me to go through it with you? Would that help? And Helen gave the example earlier of, you know, you need a form signed for an operation. You know, asking people in a very approachable way or in a very kind way, are you all right there with that form? Is there anything I can help with? People are usually delighted. So for us, again, as with Irish Cancer Society, one of the things that we've done, and particularly because we've taken, I suppose, a staff up approach, is we've actually secured funding within our own organisation for having a bespoke e-learning programme for all our staff who are working in mental health settings. There are particular challenges in mental health. People come to us highly distressed, with very low mood or extremely anxious. Very often, their concentration, their ability to assimilate and to understand information is often out the window because they're just so distressed. So we have, you know, so whilst people may have very high levels of health literacy in their normal day-to-day lives, when they become unwell or they become very vulnerable, that can deteriorate significantly. So we have to take that into account all the time. And I suppose we as a service we're really, really committed to, you know, understanding where people were coming from, understanding and asking them, what do you need? And we have quite significant service user engagement structures in our own service here. So we're actually able to garner the views of people who use our services. What do they like? What don't they like? And all of those things, I suppose, have been key to us in actually really driving forward the whole health literacy agenda within the service. So I wanted to talk specifically, and just for a few minutes, and I know time is short, really around what I call the COVID response. Other people call it the digital transformation. But for me, it was a response that was driven out of COVID coming to the world, I suppose. And, you know, in March 2020, when COVID first hit, we all sat in this organization and looked at each other and said, well, what do we do now? Because we went from being very much face-to-face, a person-to-person organization, to a Microsoft Teams organization almost overnight. And suddenly everything that we had done as a service and as a hospital was upended. You can't talk to anyone, you can't stand in front of anyone, you have to wear a face mask, all of these things. So I suppose we had to change and transform very, very rapidly. And because we migrated onto a digital platform, we were going to struggle. So I suppose one of the things that we did was we immediately set about buying a lot of devices for our inpatients here in the hospital. So I think initially we bought 100, 150 devices so that when people come into hospital, if they didn't have a device or they hadn't used the internet before, we were able to give them a device, which was a very simple tablet that they could use. And we set up a service user IT support, which really their role was to help people to get onto our programs because they were being delivered digitally, to get onto their appointments for their one-to-ones if it was being delivered over Microsoft Teams. And I suppose we went from, we would have had a lot of people who wouldn't have huge digital help. People saying, I've never used the internet before, I don't know what to do, to actually getting people online, using the online service, because regrettably in the beginning, that was all that we had. And I suppose we put a lot of thought and a lot of work into how do we communicate to service users. So we deliver a full inpatient program, which is a series of educational talks, lectures, I suppose practical workshops, yoga, relaxation classes. We deliver that online every day. And the way that we do it is we either, if people have a digital device themselves, they can use their own personal email, or we will give them a device. And people get a daily email and it lays out all of the links that they need for the day in chronological order. And we color code by day. So Friday is always kind of a pinky purple. Saturday is green. Sunday is blue. Monday is yellow. So we have so it makes it very easy for people. They always know the Friday is kind of a pinky color. So they can't make errors. And the way that we have laid things out is just, you start at 9:45 and it's chronological for the day. And all it is we don't give them all the background blurb that comes when when you create a meeting. We give them the link. Click here to join the meeting. That's all that they need. They don't need all of the other stuff. So we previously would have provided daily sheets for people of all the activities. So we do now do it in electronic format. And it was really hard to make it as simple as possible. But I suppose we also remain mindful that, we have huge challenges for people with literacy and health literacy. So rather than just say to people, digital only, we still offer paper formats if people want them. We believe in taking the roadblocks away. It's really about whatever somebody is able for. And, at the beginning of someone's journey through mental health services, they might only be able to manage a page at a time. By the end of it, when they're feeling better, they're well able to take on more information. So one of my standard things when people come down looking for information, I have, I suppose, a whole series of resources that I've pulled together over a number of years on various mental health conditions. So if someone comes down to me and says, Mary, I need to learn about DBT, which is dialectical behavior therapy, which is a type of therapy which we use for people with emotional or psychological difficulties. Concept is quite difficult. And if you were to read a book on the subject, I know I struggle with it and they're quite technical. So I would say to people, would you watch a video on that instead? Oh, that'd be great. I said, I can give you the information as well, but you might prefer the video. So I give people the choice. So they have an option. Well, I can use a video or I can use this. And then we as a service this year have commissioned, I think we are producing a total of almost 50 different videos, basically short information pieces around all of the major mental health conditions. But again, short information pieces around coming to hospital, what to expect, what the process will be like. And I know we've just finished filming those and the intention is that they will go out over the next couple of months. For me, the biggest challenge within our service, I suppose, has been you know, that this transformation to digital has been huge. And we have, you know, we have some people, even people who are in their late teens, early 20s, are not all digitally literate. You would be surprised. So I suppose our approach of having somebody that can support them through this journey, having a standard tablet that they can use, has been really innovative for us, and has really empowered our service users to be able to engage. And in many cases, service users have come back to us and said, you know what? This has opened up a whole new world. When I go home, I'm going to get a tablet and I'm going to be able to connect to the internet, and I'll be able to do X and Y and Z. And I think it's been fantastic. And we're very fortunate, I suppose, within our own service that we already had an electronic health record prior to COVID. So we were able to respond rapidly. Our biggest challenge was getting enough devices. But in terms of, I suppose, our own staff, they went on a big journey too. You know, many of our staff are face-to-face people, and suddenly we're saying on the computer. But I think for us, the biggest challenge still remains, which is really around empowering service users. It's a daily thing that we have to do. So we're still a work in progress 5 years down the line. Our expectations, you know, my own expectations in some way about being literacy friendly, whether it's digital, general literacy, health literacy, our expectation in life is that it's A to B. The reality in life is it's messy, it's complex. There are so many factors to consider within an organization. You know, we're a relatively small organization with 700 staff. We operate probably 350 beds, but it's still messy. It's never straightforward. But I think you're always hitting for that end goal, and it does change a lot over time. And I think that's the piece to be mindful. You're always going to be adjusting. There's always going to be something new. There's always going to be something that throws you sideways that you think, oh no, we had this nailed. And suddenly somebody will give you an out and, you know, a left of field response on it. And you're going to go, I never thought about it that way. So I think it's an ever evolving thing. It'll always be changing. For me, it's something I remain hugely committed to, as do my colleagues, and as do the senior management here. So for me, it makes doing this much, much easier. We all forget things at times. We all forget that, you know, not everyone understands what we're saying. But I think the key to becoming literacy friendly is to be ever mindful, but also, you know, to check in with yourself regularly, to recheck things. Did we do this the best way? Is there a different way of doing it? As I say, the reality is a lot of squiggles and up, down, sideways, backways, but at the same time, we'd still reach the same end goal. By being literacy friendly, we empower the people who are most important to us, the people who use our services. And empowering people, you know, helps them recovering. When people understand things, it takes the fear away. So thank you, everybody. That's all I have to say. I hope I haven't gone too far over time.
No, Mary, look, that was super. Thank you so much.
Sweet.
I let you go on because I thought it's worth having it, because I think we haven't, you know, had that input.
I didn't do too bad.
No, you did great. You had 20 minutes, look, and everyone sort of got a sweep. It started nicely with Deirdre, with the setting the scene, with the statistics and where we are sort of nationally. Moving on to Sarah, I think, who gave us that really great sort of example around the cancer health literacy and the resources, and then finishing with yourself on the whole practical side, to me was a lovely way to flow it. So thank you so much for your time. And I know there is and we've lost one or two people, and they've said their thanks, and that's fine, and that's absolutely fine. There are just two questions in, Mary, that we might just take if they, so there was one thing about accessing and funding devices, and do clients take them home, or what software you use? Yeah, so we use Microsoft Teams. We actually paid for the devices ourselves. People use them during their inpatient stay. We are looking at, you know, maybe having some people who are on our home care service or our day patients. We're still a work in progress, but it's our inpatients primarily. And we just use a basic, simple device, and our service user IT sets it all up for them, so people have access to their personal email. So we customize it to what people need. Some people want to be able to, you know, look at Channel 4 or RD News. So as well as them having, you know, all their health information and their appointments. And then what we did was we assigned each tablet an email address, so that if the person doesn't have an email, we can still send them information. And then that stops the minute that they leave. So it's been Yeah,
it's been
great.
challenging.
No, and I know, Mel, you have a question there. I mean, the last question, I don't think we probably don't have time to go into due depth. Mel was asking, do you think that the patients have benefited from your health literacy work, I suppose, anecdotally or?
I hope so. I mean, I can only, I suppose we haven't done a big evidence piece around it.
Mm-hmm.
I suppose I can only speak from personal experience. And my personal experience is that if you ask, you know, I encourage people, no question is ever stupid if you don't know the answer, first of all. I encourage people, you know, and all the time to talk to their team. If you don't understand something they're saying, please ask. Or a lot of patients or service users will come down to me. I do think it has benefited people. I think it's made it easier for people to access information. And I suppose I tend to discourage Professor Google. Mm-hmm. We have developed a service user portal whereby people can access good, reliable information. Right. Professor Google is not my friend.
Yes. Yeah. No. And I think what I'll be doing, so when we are linking in with Deirdre in the department and the next phase of the MPOL research, we'll certainly be saying that St. Pat's should be a site to maybe if they're looking for case studies or pieces of work, I think it would be a really useful site to go in and do that little bit of evaluation with the staff and the patients, which would be great.
Yeah. And as I say, look, if anybody has any queries outside of this, I'm happy to share my contact details and, you know, we're happy to just share our experience. Yeah. You know, it hasn't all been rosy. It's been challenging at times, but we're still a work in progress. And I think we're still moving forward and that's what counts.
Yeah, no, and what I'll do for everybody, so thank you all for staying with us that extra few minutes. I will ask Deirdre and Sarah and Mary to send me their slides. We put them into PDF and a thing, and I will forward them on with the links that we also sent today and a link to the video. So it'll be in a few days' time and a link to the recording so that if you have any colleagues, if you found this useful, I really hope that you did. You know, it was a good hour well spent. I certainly learned bits again. You know, I always get something from these and the questions are great because we see we're engaging with people and it was a great turnout today. We, you know, nearly 40 people came and as I said, over 80 had applied to come. So we'll put that up and share it out and spread the, you know, important message that health literacy needs are there. We need to be conscious of them. We're working with lots of agencies and government to find solutions and we'll keep at that work in NALA with all our partners. And if anyone has any questions, my email is there and you can come back to me. So thank you very much for staying the course, everybody, and to our three speakers, Deirdre Coy, Sarah Lane and Mary O'Hora. And I wish you all a lovely afternoon for the rest of the day. Thanks a million.
Thanks a million. Take care.
Thanks.